Hello, my name is Alison Bean, and I am an assistant professor at the University of Pittsburgh. I am deeply honored to be one of this year's recipients of the Richard Matterson ERF New Investigator Research Grant. Thank you so much to the Foundation, as well as to all of the donors who make this award possible. The title of my grant is Extracellular Vesicles for Tendon Regeneration. Does Donor Age Matter? I would like to take a moment to acknowledge my co-investigator and mentor, Dr. Fabrizia Ambrosio. Dr. Ambrosio is an internationally recognized researcher in the field of regenerative rehabilitation. Her guidance on these studies has been and will continue to be invaluable. Tendinopathy is caused by repetitive tendon overloading, and its prevalence increases significantly with aging. Standard treatments for tendinopathy include physical therapy, NSAIDs, and corticosteroid injections. However, many patients will continue to have refractory symptoms. More recently, biological treatments using the patient's own blood, tissue, or cells have become more popular. Some examples that are currently being utilized in the clinic are platelet-rich plasma, bone marrow aspirate concentrate, and microfragmented adipose tissue. Stem cells are also being tested widely in clinical trials. More recently, extracellular vesicles, or EVs, have been suggested as a potential new treatment for a wide range of conditions. EVs are lipid-encased nanoparticles secreted by many different types of cells. They contain proteins and nucleic acids, including DNA and RNA, and there's growing evidence that EVs from the blood or from stem cells can have regenerative and protective effects. EVs are also more stable and less immunogenic than stem cells, making them a very exciting potential therapeutic for a variety of conditions, including tendinopathy. As we investigate EVs as a potential treatment for tendinopathy, we begin to wonder, are everyone's EVs the same, or are there some people who have EVs that are better for tissue healing? In particular, since aging is a risk factor for tendinopathy, we want to find out, does the age of the individual from which the EVs are isolated matter? And if so, what drives this difference? Using the funds from this award, we will begin to answer this question using in vitro studies. First, we will isolate tendon stem progenitor cells from aged mice, and then we will isolate EVs from the blood of both young and old mice. We will then co-culture the tendon stem progenitor cells with the EVs from the young and old animals in order to compare their effects. The first aim of this study will be to look at the effects of the EVs on the cells and see if there are differences in EVs from young and old animals in terms of their ability to stimulate cell growth and extracellular matrix production. In the second aim, we will dive deeper into understanding the mechanisms underlying these potential differences, comparing the microRNA contents of young and old EVs, as well as the downstream changes in the tendon stem cell mRNA expression after treatment with EVs. Our overall hypothesis is that young EVs will restore a more youthful phenotype to tendon stem progenitor cells compared to EVs from aged mice, demonstrating that it is essential to consider the source of EVs as we move forward in developing this technology and translating it into a novel therapeutic for our patients. Thank you so much for your attention, and thank you again for your support of this work.